Hello, good morning, everyone. I'll keep my ties on straight. Hey, it's Dr. McClellan, and I have never done this before, but I'm doing a Facebook Live. I'm at the Atlanta Breast Surgery Symposium in Atlanta. Was fortunate enough to be a presenter both at the breast meeting as well as the oculoplastic meeting, and they're on a break having coffee and looking at the exhibits, and I thought it would be a great time to come on here and see if anybody had any questions or about plastic surgery, talk about a little some of the upcoming videos, and really talk about the breast surgery symposium, because I have thoroughly enjoyed it. I think it's the best meeting that I've gone to. I've enjoyed all the presentations, the access to the attendings that are really at the cutting edge of plastic surgery, both breast as well as oculoplastic surgery, are very approachable. Hello, hi, Dr. Z. Very approachable to ask questions, answer questions. I have learned a number of things that change in my practice that you can really pull people aside and get the details that you need to become a better surgeon. And that's what I want to be, as a better surgeon. And I hope that everybody watching, if you're going into healthcare or if you're in healthcare, that you want to be better. I've been really excited by the number of residents and med students that have been here that like the channel and watch the channel, as well as other surgeons. That's very humbling. You know, it's you never get to kind of see the impact that you have. And I've had people come up to me and say, hey, I had a surgery that was like your eyelid surgery, and I used some of the tricks that you used, and I didn't like some of the stuff that you did, so I did it a different way, and the patient had a great outcome. That's exactly why I love doing this channel, and so thank you very much. Does anybody out there have any questions? I see we have a few people on, not many. I just decided, hello, Fazi. Hopefully I pronounced that correctly. Thank you, Ahmed. I hope you have a cool day as well. Dr. Z, where are you from? And JS Sharma, yes, you were the first one here. Oh, the other thing is send feedback. Do you guys like this sort of thing where you can ask questions about plastic surgery? Particularly, I think I'm going to do a video on getting into plastic surgery. I recently did resident interviews for WVU, West Virginia University, who started a plastic surgery program. The candidates were just amazing, just an amazing group of kids, young people. And, you know, I think the experience with them, I'll definitely do a video on things that I think you could do to improve your interview or improve your skill set to plastic surgery. We got a couple more. Are you guys here because you're trained to be a doctor? I hope so. You know, so why do I do the channel? I like to teach. I'm in an area where I don't have access to a lot of students. I guess that's going to change with the advent of the residency program, but I like to teach a lot. I like to show people what I do. I like to look at my surgeries and figure out a way in which I can get better. And I also want to educate patients as well. And my hope is that we can create videos that are beneficial to a broad spectrum of people, to those that are interested in surgery, to those that are plastic surgeons that either do something similar to me or disagree with me. I think the discussion makes everybody better. Okay. I'm Dr. Sarah, plastic surgeon from Morocco. Hello, Sarah. Oh, well, thank you, Sarah, very much. You learn from my videos. I also look at YouTube videos for surgeries, and I learn from everyone else. I think this is just a wonderful tool for us all to get better. J.S. Sharma, yes, I did say your name. That's awesome. The other thing that I wanted to reach out to you guys is, what sort of videos are you looking for? In particular, obviously I do surgical videos, and I do them as they come along. I have a plan as to what sort of surgeries that I want to shoot a video of, and I have plans on, I think, inadequacies in previous videos that I shot that I think I could show things a little bit better. I'm playing with cameras a little bit. I did use a DSLR camera, and then I moved to an iPhone. I'm really not happy with the quality, so I'm going to go to a 4K video camera to show the little details that I may have missed on prior surgeries and better. So I'm working on video, I'm working on sound, but what type of content would you like as well? Anybody have any suggestions? I like the cool videos, like the BB pellet extraction. That's great. That BB had been in there for quite some time, years for sure. Let me tell you about, while you guys think about what sort of videos you want, I just want to do a quick review of the Atlanta Breast Symposium. If you ever get a chance to this meeting, so I've presented at American Society of Plastic Surgeons, obviously an international meeting. Maybe you guys have been there a number of times, at least 5 or 6 times. It varies from Toronto to LA. I've been to local meetings in the Northeast as well as the Midwest, but the Southeastern meeting, and in particular the oculoplastic and the breast meeting, is just my favorite meeting. The people that are on this meeting are just amazing, from amazing microsurgeons like Lisa Wu to Dennis Hammond for Latissimus breast reconstruction. It doesn't get any better than those two. To obviously Mark Codner, who runs the meeting. What I'll try to do is I'll try to get the faculty and list of conversations on here. We're more interested with hand surgery and breast too. Sarah, is a lot of your practice based on what sort of hand surgery do you do? Is it elective, trauma? Jaya Sharma, I like the cool videos. Trauma. Oh, thank you. I know you're always waiting for your videos. I am obviously really busy, and I love to create quality videos. So sometimes it takes a little while to get them out. I want to make sure I have some follow-up, and sometimes I just can't get people to come in and follow up a year later to get those traumatic hand, etc. One of the talks that I really liked was from MD Anderson, Dr. Clemens, who spoke about the robotic harvesting of the latissimus flap through a single port incision. Really, really fascinating talk. They're able to harvest a latissimus with the robot in about 40 minutes with no external scar on the back, which I think is a big step forward. I think there's going to be a big learning curve. I think it's going to be resistance to doing this in the community, as well as from payers. However, I think it's a big step forward. I'm a fan of watching your videos, learning a lot. Yes, you can always send in questions. I do want to say I get a lot of questions about people that have injuries from all over the world that want me to look at them. I really discourage that. I cannot give medical advice over the web. I certainly think that anybody that has a medical problem should see a qualified surgeon in their area. There's so much to gain from the physical exam that you can't gain from a static picture. So I really do encourage those of you that are looking for advice to seek someone local. Claudia, please send questions. You can send questions. There's an email on the web page. Hi, Nat. Hello. The other thing that I really, really liked yesterday was the fat grafting panel for breast reconstruction. I think fat grafting is becoming such a great additive to breast reconstruction in general, from in the first stage and the second stage, specifically for upper pole, for radiation necrosis on the breast. And there were some really great talks by Louis Bucky, Namnoon, and Loskin. I thought all of their talks were excellent. And finally, from the oculoplastic meeting, which was 2 days ago, I was scheduled to present 2 different papers, one on the periosteal bone flap, which I think I probably will upload to YouTube, just do the whole presentation so you guys can see it. Oh, thanks. Hi, Nat. I appreciate the heads up. Could you live stream an operation? That's a neat idea. I'll have to think about that. You got to find the right patient. Make videos about correct physical examination before blepharoplasty, rhinoplasty, and breast augmentation surgery. Those are great. I think that's a good idea. Please be kind. Hi, Nat. Yeah, I agree. I think preoperative examination would be great, particularly surgery. It's a little bit more difficult to get those sorts of patients to do something like this for breast augmentation and blepharoplasty, rhinoplasty, etc. But it's certainly something that I can work on if you would find that more valuable. Back to the oculoplastic meeting. So periosteal bone flap, and then what I do in the lower eyelid. As my practice matures, and I see more people at meetings, I feel as though doing less in the eyelid and less on the face is more beneficial than more. And I think you're starting to see that really moving from the 80s and 90s, which was much more invasive. You're starting to see that go back down and become much less invasive and see more additive treatments. So I'll see what I can do on a video on less is more and lower blepharoplasty, kind of my talk here in Atlanta. Anything else? No other questions. Well, for the first one, I think this is pretty good. If you guys like, give it a thumbs up. I guess this saves to the videos. Could you come to Turkey? I would love to come to Turkey. Give it a thumbs up, and maybe we'll try to do this again, and I'll collate some questions so that I'll have a little bit more content and a little bit more organized, and hopefully you'll get more value from it. And I'll try to set it out in advance so that more people can attend and ask questions, because we don't have that many. I think we only have 10 people. Thanks, everyone. I hope you have a great day wherever you are.